Okay, I think it's time to begin our webinar. Hello, everyone. I'm Nikat
Hello.
Sudha. I'm the board, WHTF Women in Health Together for Future board chair. And it's my pleasure to welcome you all to this webinar. And before I, give you a detail about, I think the moderator will give you the details, but I just would like to give you a brief background about WHTF. WHTF, we started as a small group of network of members, and in 1991, as part of an international network, and we worked. We have a very dedicated group of educators and researchers, and including public health experts, and we have done. We have several achievements that could be, we are proud of it, and we have, for example, we have student mini grants, we have learning resources on women's health, different modules, and we are working on separate community of practice, and we have several modules in that, which will be available soon, maybe by the end of the year. So it's my pleasure to give you this briefing, and it's also that we have our website, which you can see the link, and you can go to our website and you have the opportunity to register as a member. We have different classification of membership. As I told you, in 1991, we started as a part of the network, and in 2019, we registered as a separate entity in the Republic of South Africa. And we work together with the University of Western Cape and the Community Health Sciences, with the Department of Community Health Sciences, and we operate from their department, from the office that is provided to us by the Department of Community Health Sciences. So we offer several activities we have, and one of them is, of course, is our monthly webinar. And we are fortunate that we have today, sorry, Tony Claeys, and he is a researcher and educator, very enthusiastic, and he's been working in low middle income countries, and and it's our privilege that he has accepted our invitation today, and he is going to be talking to us on a topic which is very important for for all of us who are here today. And I will leave it to our moderator, Amani, to give you the brief, brief detail about his topic, about Tony. I have not done justice to Tony, but I think Amani will do justice to that. Okay, thank you all. And I hope, okay, one thing more that I would like to, sorry, Amani, I'll just take a few seconds. We have this link available to you for certificates. If you you will be able to fill the feedback form through that link, and you will be given the certificate. In case you will also receive an email at the same time, so that you can fill the form, and from that you will get the certificate. The recording of our webinars are available, and very soon you will get an email from us, sharing with you the recording of the webinar. So I hope that you will enjoy this inspiring talk by Tony, and you will continue to be part of us and join us for our monthly webinar and other activities as members. Thank you very much. Amani, over to you.
Thank you, Nigat. Hello, everyone. For those who do not know me, I am Amani Refat from Egypt. I'm Professor Emeritus of Public Health and Preventive Medicine, and I have the pleasure of being one of the founders of the group from its start. And I'm currently the vice chair of this respectable foundation and organization. Well, today I have the pleasure to introduce Dr. Tony Claeys. He's going to talk to us about a very important project he is responsible for, which is Inter-sectoral Synergy for Maternal and Child Health Project, and learning from real challenging collaboration in Kenya with community. So Dr. Tony Claeys is the researcher and coordinator in Center of Expertise for Care Innovation, European Regional Board member for the network, and project coordinator for a project, VLIROUS Kenya, and project member for that project in South Africa. We are very privileged to have you, Tony, and we welcome your presentation. Sorry. Okay. Yes, Tony, please, you can start and share your presentation with pleasure. Thank you for being here.
Thank you, Amani and Nigat. Yeah, the honor is totally mine. Yeah, I'm very privileged to work with these strong women from already a long time. Together. Yeah, and I'm really pleased that I can attribute from the angle or the perspective of education. I'm indeed a researcher in Belgium. Yeah, and I'm going to share my screen with you. The only thing I want to say is I'm not here alone. Yeah, I see, for example, Robinson Okeo. He's one of the members from the project we are now doing in Kenya. And if I'm correct, some of the other partners will also join the session. Yeah, so this is not only my talk, this is a talk of a team, of an interprofessional team that is coping with maternal and child health in Kenya. So let's share my screen.
Sure.
Okay. Okay. Can you see it?
Yes.
Can you see my screen? Yes?
Yes, okay. We see it, yeah. Yeah.
So, okay. So this was the invitation. Yeah, thank you for the invitation. Yeah. I'm going to talk about the Mama Link project. Yeah, the Mama Link project is the name that our Kenyan partners gave to this project. Yeah. And it was a project that was approved by the Vlerios. Yeah, Vlerios is a funding agency, and it's a project about capacity building. Yeah, capacity building across universities, but they always need, not always, but our project has some kind of community impact. Yeah, and that's what I'm going to talk about. So it's called Inter-sectoral Synergy for Maternal and Child Health. Yeah. Learning from challenges, collaboration across professions and community, because we really want to include the whole team. And nowadays, a team is more than the doctor and the nurse. Yeah, it's also involving the patients or the community members. And certainly they do it in our project. Okay. So it's a collaboration funded by the Vlerios agency, but we are collaborating with several universities in Kenya. And one of the universities is the Alupa University. Another one is the University of Eldoret. The third one is the University of JKUAT, and the fourth one is the Maseno University. Together with the school I'm working for, Viva's University of Applied Sciences. So you see, it's quite a challenge, to work across universities, and it's more a challenge when it comes to intersectoral approaches. It's quite new, because it is a really a new perspective on looking on mother and child health. Okay. There are several references that say regarding to policy that you need to collaborate on maternal care and maternity care. You have to collaborate on the implementation of interprofessional education, because it's limited. There are references that say, like the collaboration of maternal and newborn health. You can click on the link. The link is working. I tested it. So that highlights that interprofessional initiatives in maternal and newborn health are still insufficiently embedded within healthcare and educational programs. And that's why it is important to rethink education. These topics must be in education if we are preparing the workforce of tomorrow, for collaboration on this very specific topic. So more frameworks, for example, the framework of the WHO, that highlights that strong health systems require interprofessional education and collaborative practice to improve the quality of care and the health outcomes. The WHO midwifery education framework also states that the framework needs high quality maternal and newborn care, that it depends on evidence-based and interprofessional education with collaboration across disciplines as a key component. If you look to these 4 references, we really applied the recommendations of the WHO in the approach of our project. Okay? So it's really about evidence-based practice, it's about education, it's about collaboration with the field and so on. It is a unique insectoral approach because most existing initiatives focus on a single domain of care. Over here, we bring different domains together and we make them actively work together. It's quite new. It's very innovative because people are not used to do it. If you're thinking about collaboration, interprofessional education, most of the time you think about the traditional collaborations that exist, like the nurse and the midwife and the doctor. In this project, we look to the challenges that also can be tackled by other sectors, other professions that are not the traditional sectors within mother and child care. Okay, so only a few projects on mother and child care addressed through a truly intersectoral collaboration. So really intersectoral. We bring, for example, education together with health, with public health and agriculture. Our goal of the project is bringing together those multiple perspectives and expertises. Because when you look to the added value of this very specific program or very specific project in Kenya, it really shows that you need those different perspectives and that you need those different expertise to tackle the problem on mother and child health. And then the goal is to create a collaboration, and we really succeeded about that, around mothers, children, and families. So not even the community is for sure implemented and taken into account during the whole project. It's really a bottom-up approach, to build the capacity of universities in Kenya. Good. Okay. So if you look to the references, and to what our project, we are really filling the gap, that although policy strongly emphasizes collaborative care for women and babies during and after pregnancy, there is still a limited interprofessional education preparing those healthcare professionals for effective interprofessional collaboration on or in mother and child health. That is the gap we're trying to tackle. So, good morning. And then mother and child health, is influenced by multiple interconnected factors. It's not a linear problem. No, we have multiple layers, different elements of the context where people are living in that are interconnected with each other. And therefore it requires a real collaboration across the different sectors and professions like we do in our project. So to be more specific, our project, for example, brings together expertise and perspectives from teachers, students, professionals, in the field, from healthcare, public health, agriculture and nutrition, and also education. So we have a lot of expertise that are really focused on the same problem, tackling mother and child health. Well, I already said it before, most of projects, have a look to the problem only from a healthcare perspective. Okay? But the context is more than only healthcare. It's also public health. It has to do with what you eat, how you grow your food, how you educate your people, and so on. So it's really that focus that we want to have in the project. So I told you that it is a project from a team, yeah. And last year we made a movie, and I'm very honored that the professors or the PIs in the project in Kenya from every university were willing to tell us about how their very specific topic is going to attribute to tackle the problem on mother and child health. So I'm now going to show this movie. It takes 10 minutes, but in that movie, you clearly are explained how it works. So I'm now going to share it. And if you don't hear the music, you can interrupt me, but normally it would be okay. Enjoy.
Chieng' moro nyathi moro nyuol. To nyathi mama ni muoch nokaya kaya mang'eny kabisa. Kano te mondo push to nyathi ok wuogi. Nyathi ne duong'. Ka nyathi onyuol, nyathi ok oywak maber. Koro nitiere gine moro incubator moro kanyo. Waneno ka nyathino, waneno ka koro nyathino yweyo matin. Koro bang'e no, kotieko seche moko kanyo, koro ne nas ma kanyo gole. Kosebet matin to nas no min nyathi chak wacho ne nas ni yawa nyathina ni ok ane ka koro dhi maber. Koro ka nases ne biro ka ng'iyo nyathi, gineno nyathini kendo ka koro ol. Girashe e water bus. Ka gichopo Yokia, nyathi ok tho gi kanyo. Kendo nobedo malit kabisa ne mamano, ne first born mare. Tija en linking jotuo gi osiptal. Watimo referrals ne jotuo, obed nyathi matin nyaka old age. Gimachielo mwatimo, wapuonjo, wabedo ka gi health talk ne community.
The niche of Alupe University is actually in the health sciences. And we train students in nursing, in physiotherapy, in medical psychology. We prepare students in public health so that they are prepared to go and assist the mothers out there during their pregnancy and throughout the process of motherhood. On a broader perspective, Alupe University is set up to do 3 key activities. One is, of course, training. The second one is research. And the third one is community service. So this project strengthens the community service perspective of mandate of Alupe University. Our students across the 5 departments of the School of Health Sciences go out and spend about 30% of their time at the university for 4 years working in communities. Some of the key challenges have been the maternal child health. We have a very high maternal mortality, which stands at about 530. We also have a very high mortality of children under 5 years. So therefore, this project speaks directly to the mandate of the university.
The university's main focus is teaching and also doing research and community engagement. So those 3 angles of the university make this project very important, and especially for maternal and child health, because we have many problems with mothers. In public health, we know that maternal mortality is a big challenge in our country, and especially in remote areas. And child health, many times, children die because of preventable causes, same as mothers. So we do training our students during the pre-service so that when they come out to the community, they can be able to know how to interact with the community, know how to do research with the community, and be able to get solutions together with the community on issues that affect them. So we want in this project to see how we can best train students on evidence-based practice, and so that they can have the skills and knowledge on how to do research and how to also work together with the community in their community activities. The importance of this project in getting students of different disciplines to work together so that they can be able to solve with the community problems of maternal and child health.
The basis of every individual begins with food. And to get food, you have to get agriculture. And for somebody to be healthy, for the mother to be healthy, for a child to be healthy, agriculture becomes very critical. Because if you don't feed the mother well, the child, even during pregnancy, the child will be born underweight or not having fully matured.
Well, the project is very important to us because issues to do with the food security, nutrition, health, all those things are very important for us, both as an institution and then as a nation also. For us as Kenya, I think it's very significant because if you look at the 4 universities that are involved, there is the issues of maternal and child health in the different parts of the country. Several ecological zones, or rather different climatic zones and different in terms of even activities. You find like the areas where Jomo Kenyatta University will be focusing on is arid and semi-arid, mainly pastoral communities. There are a little bit of agriculture, but mainly pastoral. The area we are focusing on also is an area where is extremely prone to some of these diseases like HIV/AIDS, because the highest prevalence of HIV/AIDS is found along Lake Victoria Basin. And so we are focusing and working on an area with very high very high rates of infection, and area also with a very low food security within amongst the communities.
HOPE is a community-based organization registered by the Ministry of Labor and Social Protection in the Republic of Kenya. Just from the name HOPE, the project will bring a lot of hope to this community in terms of supporting maternal and child health. Currently, the community is faced with a lot of challenges, and so we are here to give them hope that however much the challenges can be, we can find a way out by supporting maternal child health so that we reduce the poor indicators of maternal deaths which we are currently experiencing here in the island. The NGO contributes so much to the goals of this project because we are the actual implementers on the ground. You can have the idea, but now the real people who are executing the ideas are us, the HOPE CBO, which is working with the community health promoters. So we are the real people at the last mile team that's doing the actual work. So it is us who will be doing the actual implementation, making sure that all our pregnant mothers are registered, tracked and enrolled on antenatal care, and also that they deliver within the health facilities. So our NGO will play a very pivotal role in the actual program implementation.
So that was in short how the project is built up and what the focus is of every university. Yeah, and I'm really always very proud on the team I'm working with, because you know it's not easy to have a structure and to make changes in that very strict structure. It's not easy for them. So what you saw in the movie is that they are already used to go to the community, but we were missing the interprofessional approach, yeah, and the crossing links between the different sectors, yeah. So you also saw that we work a lot with the community healthcare workers. Community healthcare workers are crucial in our project, yeah, and students will be involved throughout the project together with community healthcare workers to work on very specific topics. And I'm going to talk about that right now with you. So our approach, one of the goals of our project is to work evidence-based practice in the field. Yeah, we know there's a lot of evidence. I'm a researcher myself, and it's very difficult to find the correct evidence, yeah, in literature, because there's so many literature, yeah, so many interesting things that have been published, yeah, but we really would like to learn students, yeah, and not only students, but also people from the community, like the community healthcare workers, yeah, to work evidence-based practice and to apply the best evidence that is existing for a very specific challenge. Yeah, from one of my previous projects, I have learned that community healthcare workers really asked me, can you please train us on very specific project? Because sometimes they're very alone in the field, and they have a lot of responsibility. Although Kenyan community healthcare workers are trained very well, they still miss some kind of information for very specific challenges. So we really want to train them, but training the community healthcare workers on evidence-based practice means also that we need to train students and future professionals on on evidence-based practice. Yeah, so. Students will go into the community and give workshops. Yeah, we would like to work with a lot of visual material. We developed already, I think, 10 movies, yeah, on very specific topics that came out of some kind of needs assessment. Really, what do you need and what can we develop for you to make it more work, to support you during your work in the field. Yeah, so it means training students and professionals, which is also quite good, because even for students and even for professionals, it's very hard to find the correct information. And by providing that kind of information through visuals, yeah, it's on. Most of the things will be immediately over there and very hands-on for the people. Yeah, most of the people in Kenya have a phone, yeah, and all the things we develop is applicable on their smartphone or on their phone, yeah. So strengthen education through evidence-based practice means that we aim to bridge the gap between research education and real-world practice. Yeah, what you learn at the school, I was a student myself, is sometimes very different from what you're facing in the field. Yeah, so and what you're facing in the real world. Yeah. So that's what we focus on. We include students, teachers, and academic staff because it's capacity building. We also need to improve, or we will try to improve some challenges at the university level. It's not only, I'm not only talking about Kenya, I'm also talking on our challenges over here in Belgium, as in Kenya, and I know of your countries is community field visit or community work service learning is very common. For example, in Belgium, is just starting. It's not so easy. So we can really learn from each other, and very fond of that aspect. Yeah. And we also target healthcare and social care professionals. In this case, especially the community healthcare workers, in the field and on the island for existing, or in the NGOs or CBOs we are working with. And you saw Robinson Okeo. He's one of the important people that leads the CBO Hope, at the Mafangano Island, and then we have a second one. It's Abakunta on the Mafangano Island. So we are really collaborating with the NGOs and the CBOs to train those kind of professionals. Yeah. Our initiative supports, or our project supports, interprofessional learning. Yeah, we will send in the future students from agriculture to very specific areas to give information on the needs of community healthcare worker people. For example, on agriculture, on nutrition, and so on. And then we support critical thinking and clinical reasoning. Yeah, critical thinking is nowadays very important because you have a lot of social media. Yeah, and social media is not the way to go. We really want to use scientific evidence, and evidence that works, in daily practice. And it is also lifelong learning across the different sectors. Lifelong learning from the teachers, because an interprofessional, intersectoral approach is quite new for everyone. So that's lifelong learning for teachers. But it's also lifelong learning for teachers, for example, to recognize that if you want to tackle mother and child health in Kenya, you not only have to look as a nurse about healthcare, but that you also have to look to the different elements of the context people are living in, so related to the different aspects or different colleagues you have in the field regarding that very specific aspect. Okay. So the quote for this part is: integrating evidence-based practice into interprofessional and community-based learning strengthens both education and healthcare outcomes. And we really hope that through the education we give to students, professional teachers, everyone, community healthcare workers, patients, families, we will improve healthcare outcomes. I know everybody is fond on healthcare outcomes, but as today we did not be able to measure healthcare outcomes. I don't know if we will be able to do that, because that's not really the focus on our project. But I really believe if you improve education, you can improve healthcare outcomes. There's a lot to find in literature that prove this. Okay, so another aspect is a service learning and community learning and capacity building. It's really capacity building for every stakeholder in the field. As I already said, the project connects universities and communities to strengthen knowledge, skills, and empowerment very specific on mother and child health. That's one about the community service learning. So we really try to send the university to the community, but we also try to send the community to the university. Now we are working with very remote areas, and for that I'm very happy to say that we have 4 NGO CBOs included across the different universities, and we installed very big screens and internet so we can train online. It's the way to go. We are 2026 and this is a big breakthrough, that we are able to connect with people from the field at a remote distance. And even for the universities, it's their NGO, but they are far away from the university. So it will improve education and collaboration between the different stakeholders. So this is a digital innovation we just released. So We use a service learning approach to bridge the academic and the community engagement. Students collaborate directly with the community healthcare workers. I was really fond on doing that because from my previous research and project, I saw that community healthcare workers were very, very, very hard. Yeah, and they were often not valued by the professionals because one of the quotes I remember was, yes, but they are not professionally trained. Yeah, so we have to start again. Yeah, that's a pity because people are working very hard. They are almost working for free. Yeah, and they really work very hard. Yeah, and then you receive a quote. Yeah, so my idea was if we bring them together, they can learn to value each other. Yeah, and if you learn to value each other, you learn to respect each other, and you see how important, for example, the community healthcare workers are and what they can. Yeah, we include mothers and families. Yeah, of course, we include mothers and the babies, but we also include the family. Yeah, one of the logos we had during writing the project was you're not pregnant alone. Yeah, if you are pregnant, there is always a father. So why can we not talk with the fathers to have a responsible role? Yeah, during pregnancy. Yeah, and I'm really convinced it's going well. More and more fathers are visiting mothers, yeah, to the clinics, yeah, for a follow-up during pregnancy. But there is still a lot of work. Is this only in Kenya? No, I also saw it in the other countries. Yeah. So approach from a family's perspective, and not only the husband but also the mother and the father from the lady who is pregnant. Yeah, if you have a child, you love it. Yeah, so as a parent, yeah, you will support it, so we will also work with them. And the local community organizations, we were in touch with different organizations like the Department of Health. Yeah, so yeah, that is what we want to collaborate with. The project promotes mutual learning, yeah, between academia and the community. That's already clear, I think. And we focus on health education and prevention. We do community empowerment. Yeah, we do cultural sensitivity. Yeah, early support of vulnerable families and capacity building in mother and child. That's a lot, I know. Yeah, but because the topic is so complex, yeah, you also reach a lot of focus areas. Yeah, so that's what we want to do and that we want to do. So the quote for this is that service learning with students, including the community, creates a two-way exchange where students learn from communities and communities gain access to knowledge, support, and empowerment. Yeah, and that is really what I love when I'm talking as a teacher. Yeah, because then I know as a teacher that they learn what they need to learn. Yeah, because they need to work in the community, they need to work with the people. So as a teacher, I'm very at ease to hear this or to see this, because then I'm thinking I'm doing a great job as a teacher. And then something I want to talk about you is it's not a new perspective, yeah, but I looked it up in the literature, yeah, and you cannot find a lot about it. It's the multi-layered learning approach, yeah. I'm still looking. If you can help me, please help me. Can you give me a theory or a model, yeah, that supports this, yeah? But you know, if you send students into a complex learning environment, they do not only learn one skill. Yeah, they are working on different skills in the same time. Yeah, so for me it's multi-layered. Yeah, if you're tackling, for example, something about nutrition and you do it in an interprofessional team, you also learn about the IPAC model, about values, ethics, communication, teamwork. Yeah, but you're also learning about the how food is produced, yeah, why it is important to produce it in a very specific way. Yeah, then you, for example, also live why people are resisting to new foods. I'm just imagining things, but you know, it's multi-layered. Yeah, and I think a multi-layered perspective of learning is a future approach, because we always talk about interprofessional education is breaking down the interprofessional silos. Yeah, you're not trained anymore as a doctor in your professional silo and as a midwife in your professional silo. No, if we break down those kind of silos, we also break down the silos and the idea that you only learn one competence during one assignment, for example. So multi-layered is really related to interprofessional or intersectional regarding my point of view. So the project creates learning on multiple levels by combining knowledge, interprofessional collaboration, and evidence-based practice in real-life settings. Okay. So first, learning about mother and child health, that is what they learn. They learn to understand the complexity of mother and child health challenges. Yeah, and sometimes complexity can be very different, even in Kenya. Yeah, so they're learning about prevention and early intervention. Yeah, they're learning about the social determinants of health and being a partner of Towards Unity for Health. And this group, we know all how important social determinants of health are and how they have influence on the context. In this case, mother and children are living. Yeah, and they also learn about a family-centered care. Okay. Then interprofessional learning is one of the aspects. They learn to collaborate across disciplines and sectors. And believe me, that's not easy. Yeah, because within our partners, they have a lot of experience, but they are not used to exchange ideas. Yeah, they are not used to collaborate from different disciplines because sometimes there's hierarchy, and that's not only in our project. Yeah, so please break down the hierarchy. And a team, for me, you're equal. Yeah, and you need to collaborate. Yeah, and if the hierarchy is still standing in an interprofessional team, yeah, it will be very difficult to collaborate. They also understand the different professional roles. Yeah, because sometimes you're not aware what another profession is doing or capable to. And let me come back to the community healthcare workers. Yeah, if they work with the community healthcare workers and they take blood pressure or they do a follow-up on diabetes, I don't know, whatever, yeah, and they see it's going well, they will see and understand why community healthcare workers are valuable, yeah, and how they can be a part of the member that is valued. Okay, and they have to develop communication and teamwork skills. But you know, this is more, it's the whole IPAC model that they will learn. And then they also learn to apply evidence into real contexts. Yeah, so they will look for research, yeah, and will translate that research result into practice. Yeah, and you know, you're a researcher, and you have a lot of experience, but you all know that research is very focused. Yeah, so critical thinking is crucial when applying research into new practices. Yeah, but first you have to find it, and then you need to learn to translate that research into that new practice. Yeah, otherwise it will not work. Then critical reflections and decision makings. Yeah, decision makings from the different angles. Yeah, regarding what mothers want, what families want. Yeah, and not only a top down. Like, I'm the professional, I'm going to tell you what will happen. No, our goal is really, let's go and sit around the table, talk to each other, and to decide together what will going to happen. Yeah, because I'm a professional, I have some solutions for you, but these solutions should fit your life and should work for you. Yeah, so the shared decision making, and using evidence in community and clinical settings. Yeah, and also learning through authentic field experiences. I'm really fond on authentic field experiences. I think they really need it at the end of an educational program, because I prefer to design an educational program from simple, very easygoing, very safe environment to a more complex learning environment, and more authentic learning environment at the end. Yeah, because that challenge you to learn what you to practice what you have learned during the program, before entering the field. Okay, the quote for this is, learning becomes meaningful when knowledge, collaboration, and evidence-based practice come together in a real-world context. And that's really what I'm standing for. Good. So this is my talk. I hope it was some kind of interesting. Yeah. Maybe I think Robinson was here, or maybe he is already out. Yeah, if somebody is here from the project, please add what I have missed. Yeah, but yeah, if you have some input, some thinkings, yeah, yeah, the questions are you can ask them. I don't know. I'm going to stop sharing so I see you, because now I'm talking to myself all the time.
Okay, no, you are talking
Yes.
to us.
Okay.
And we enjoyed it, Tony. Very, very impressive experience and real example of a successful community participation and partnership between community, academics, and health professionals for the sake of improving. And we are interested in women health. Maternal health is part of women health that we cannot deny it. And it is very successful experience that we enjoyed hearing you. I can see that the audience is very, very impressed about your work, and a lot of comments. So I hope that we have time to respond to all of them. So I will start from the beginning. Dr. Vidyahar Bangal is the most one who was impressed by your work, and he said very good initiative by the university. And then his first, and of course, Dr. Tidy responded that it is an excellent initiative. How was food security addressed? Before moving to Dr. Bangal, next question. Do you like to hear all the questions or one by one?
Can have a look. So yeah, thank you for your question about the food security. You know, at this stage we did not address food security. Yeah, but I already visited a lot of families. Yeah, and I should say, but Robinson is with us. Yeah, that there is already a lot of food. Yeah, on the island. So food is not really a problem at the island, because they have a lot of fish, they have a lot of vegetables, they have a lot of fruit. Yeah. But it's a good question, because in other parts of Kenya, yeah, we're not working yet on it. It will be harder to find good food, and and it's like the professor said, if you do not feed the mother, you will not feed the baby. Yeah. But even, we will have some awareness campaigns. Yeah, so an awareness campaign of, you also need how should I say it, you need to feed the mother who is pregnant in a correct way. Yeah. Is already a start. Yeah. So I'm not going to plow the field and to sow some food. Yeah. It's really about awareness. For example, how much sugar can you use? Yeah. Or sometimes, yeah. Sometimes they give a baby a lot of food. Is that needed? It's really about awareness. Yeah. And we will have a look about topics that are related to food. Yeah. And then we will create some visuals. Yeah. With students, based on evidence-based practice. Yeah. On literature, on what are recommendations for food. Yeah, or nutrition.
Yeah, I think and the student of agriculture would be very, very trained in that, and that would help them with the health science students. This is really
for example, the students of nursing can make a movie about of midwifery, how to breastfeed correctly, because we visited some women who were not able to give a correct breastfeeding. Yeah, but for example, if from agriculture they can say, okay, which pesticides are dangerous and which not. But it's all related to food, and that is how we want to approach it. Yeah. Okay.
The next question. Well, Dr. Bangal has 3 questions in the start. He is how is the student involved in this initiative, and is there a weight given to the final assessment of students regarding this involvement, and how are students assessed about their work done in the community. This is about the student evaluation. Yeah.
Yeah.
In
Yes,
this initiative.
students are involved in this initiative because I really want to develop all the things together with students. Yeah. So they will create the visuals. We are now, for example, we had several student sessions. Yeah. Everybody can join. It's not because it's in Kenya that not one of your students can join it. And the first session was about how do you create a good research question? Yeah, and it's 1 or 2 sessions just about that. Yeah, and based on these kind of research questions, they are going to design. Yeah, we have 40 or 50 students right now. We will have, I hope, 40 or 50 visuals. Yeah, once the research question is answered. Yeah, so that's one way to do it, and another way is that they design visual materials, easy-go materials, short movies, just to give information about, okay, if you're pregnant, for example, within the first month or within the 2 months, you should visit the doctor just to follow up. These kind of things they are going to make very easygoing visual materials. Yeah. About assessment, we are not there yet. I'm the project promoter and I do not have a role of teaching over there, but I know that everything should be in the curriculum of students. Yeah, so they are assessed. Yeah. The easy thing is that they already have a lot of community work. The different thing is that they do it interprofessionally. And I know interprofessional education is not easy to assess. Yeah. So yeah, maybe we should have a look about that in the few next years, but this is only the second year. We have 3 more years to come. Okay.
I think attendance is beneficial for the student, but as students usually look for grades and scores and how they will succeed in that. No discussion about the benefit or experience. Yes, Dr. Huda, you want to comment on that?
I'm going through the chat. I think Harini Iyer is here. And she would like to share, I think she could share her project that she did or something. I think, could you ask Harini to please in person to share what she wants to comment?
Oh, she's a student?
I think she raised her hand as well, Harini.
Okay, I think I'm trying first to respond to the questions in the chat.
Harini has given a question, but I think, we need to take care of the time. So if you could
Okay.
Harini to also share her.
Sure. I'm here and I'm happy to share my question. It's just an additional perspective that I was sharing, and I would love to know if this was something that has been taken into consideration for this initiative too. I noticed in my own research that we often, as institutions, we're always looking at how students are learning and what is the ultimate impact on students. But I feel like there's more benefits to also the institutions where we can see how if we're sending students out to communities, we also often have faculty who are probably doing research that's like community-based participatory research, and we also have other ways where we're engaging with sometimes even the same communities. So we find that when we leverage the learnings that students have into our own practices more intentionally, then that can be more beneficial. For example, like if a student notices that the community needs something or there's a particular priority that they care about, and they come back and they share it with the institutions, then that could inform the further research that we embark on with the communities themselves. So this was just an additional perspective I wanted to offer and see if something like that has been done too.
Thank you, Harini.
Thank you, Harini, for your question. Yeah, thank you. It's very interesting. Of course, we did it. Yeah, I really believe that the bottom-up approach is very worthwhile. And for examples, to develop the 10 movies, we did we did some kind of needs assessment in the community, yeah, with community healthcare workers and and pregnant women about what they need, yeah, and then they did some developments. Did we did research? No, it was not yet linked to research, but I think, yeah, it can be a way for the university to apply community engaged research to it, yeah. But as such, it's not one of our goals, yeah. But I really believe, for example, we did it with our community work, that we saw, for example, in one of our projects, that students during the holidays were very bored. Yeah, yeah, it's unbelievable. Yeah, but we developed some kind of social activities for a very specific population in the community to have, yeah, not to have leisure time, but just to make it more yeah, valuable. Yeah.
Okay.
So yeah, yeah.
Yeah.
Good.
Thank you, Tony. And thank you, Harini. I thought she's a student with you in that project.
Maybe, yes,
Harini.
but you know,
Yeah. Okay.
I mean,
Yeah.
I have so many names in that project. So if I don't see them and they don't tell
Okay.
me
I
who they are,
appreciate it. I
yeah,
appreciate it. It's a very
it's good. It's
successful
good.
project. Yeah. So the next question from Dr. Bangle about the community perception and how this community benefited. Okay. Now
Yeah.
about the community.
The perception of this project, you know, they're very willing. Yeah. When we go to the community, I see people with needs, yeah, and they really want to improve the life circumstances. Yeah. So, yeah, I'm always amazed how willing they are to contribute to the project. Yeah.
Yeah.
Did the community already benefited to this initiative? I think it will start now because of the screens we installed in the NGOs. We will be very soon in touch with them. Yeah, and we are going back in September to do workshops. Yeah, at this moment we did not have any workshops with the community, but one of our goals is that students give workshops on very mother and child health topics with the people and for the people of the community. So it's some kind of seminar like we are doing like now. Yeah, so we will invite them online. They can all come to the community NGO or CBO, yeah, and over there they can follow the workshops. Yeah, when we are in Kenya, yeah, we always visit two regions. Yeah, 1 week per region. Yeah, and during that region, from now in September, we will have workshops with students and the community members. We will have workshops on topics with the students and mothers and fathers and families. Yeah. So, yeah, I think from September they will start to benefit. But I was not expecting, because I'm always a positivo. Yeah. I was not expecting that it would take so long. Yeah. But yes, we are there. We are ready to really involve and to make this the community benefit of the project.
You know, I appreciate that because working with community members needs long time to have their trust and their interaction, because they sometimes are used by others initiative, unfortunately, to make use or to train students like a lab. But to trust and have collaboration with them and gain their trust is that need time. And I think you are going to have this success in gaining their trust because you are really working with them. We have to, yes, for the time, are you talking about? Yes,
Sorry,
Nigat.
do you have any other questions? I just want to ask Tony, this is a project that you are doing, right? And I think there's a question in the chat as well. You know, with projects, especially in developing countries or what, the sustainability of the project is a big issue. And my question
This was
is,
the question of
how
Dr.
long is
Gabor.
the project? Is it a 2-year, 3-year project or what? But one more question is, did these universities have have service learning before before your project, or is just that your project, with your project, this service learning and, this collaborative approach started with your project? Did they have the experience, the students and the faculty and the leaders of the universities? Did they have, the experience of working in the communities? Because you see, we visited, I remember going to Eldoret, right? So Eldoret, we have put it. So I was thinking Eldoret was in a larger part of the city, but I do not know if they have outreach campus or the students travel to those remote areas. How does it, this is a good big issue, and I mean, I can see the relevance of this project to my country even. And I just thinking, people complain, traveling takes so much time, it takes so much cost, taking students. So do they already have an outreach campus? So I have two questions: sustainability of the project and the status before you took up the project.
I think one of, when you start a project and it has to be installed, everything have to be installed. I think it's almost impossible to have it installed. We are very lucky that our 5 universities and even our university already have some community service learning. Yeah. The only thing that was not there, was the interprofessional approach. Most of the students, and when you look in literature, and I'm always impressed. And even I'm not saying this kind of service learning is not good, but when you send students into a community to have an assignment with only nursing, that's good. Yeah, but they also need to do community service learning interprofessionally. So adding the interprofessional aspect was quite new. Yeah, one of our challenges is that the universities have different disciplines, and for example, that they are used to work together on research. Yeah, when you're going to do something about research with a partner of, for example, Maseno on public health and a partner of JQuat about agriculture, they will find each other. Yeah, but when it comes to education, it's a challenge. Yeah, so I like challenges. Yeah, and I really believe in the social contact theory. Yeah, when people are hungry to receive examples and good practices. Yeah, so with the social contact theory, you bring people together and you show it how it works, how you can do it, and afterwards they can develop it or fine tune it to their own context. Yeah, so we really took the initiative to bring students together, to bring teachers together now, from the different universities. Yeah, because they play within their own university, and it's everywhere as such. Yeah, it's very difficult. For example, in India, to bring teachers from education from Bangalore together with two other universities to give education. Yeah, it will be much easier when it's about research. Yeah, but this is really capacity building for research. Yeah, so yeah, it's good. It was already there, community service learning, and I really learned from people from the other side of the world. Let me say that they are used to go into community because they already have a role over there, but not from an interprofessional approach or an intersectoral approach. Yeah.
Okay, thank you. We are out of time, unfortunately. Maybe Dr. Bangle question about the impact on maternal and morbidity and mortality. You can work or respond to them later, because it's very difficult. I know that this is need research to assess its impact on maternal mortality and morbidity. And however, the project seems very exciting to the attendants, and we have a lot of comments. I hope that you have the chat. You managed to read them. All of them are very impressed by your work, and I'm personally too. So unfortunately, our time is out, but maybe we will have another session in the future for having more of your experiences, maybe after September. As you said, that in September you will have a lot of implementation and evaluation, and we will share that. So this would be interesting to know after that. I thank everybody. Thank you, of course, Tony, for this presentation. And I thank all the attendants for their presence and attendance. And don't forget to have your certificates if you want to have it. And Semerji provided the link to it. So don't leave before clicking on it to have this certificate.
Okay.
Nigat, you want to end? Yeah.
I'll do that. Thank you. Sorry for interrupting you. I'm sorry, Amani, for interrupting you. I just want to say thank you myself. Tony is a very good friend of ours and WHTF. He's passionate about us, and I hope we look forward to further working with you as well. Not only inviting you as a speaker, but we hope we can work with you, with your research project. That I look forward to that. And also, Tony, we will be sharing with you the link, the link of the recording very soon. And I hope you will share it further on from your personal, emails and whatever social media forums. So this interesting topic should be publicized more and more. I think countries should get interested into it. Okay. I hope we have dealt most of the questions, but then Tony is available to us, and you can always write email if you have further questions. You can write to us, and we can forward it to, if that's okay with Tony. I've taken that advantage. Okay, so I think
Okay.
thank you, all of you, each one of you who have attended it, and I could see your interest in the last of his talks. It just shows how exciting it is, and how I think it's the relevance that matters most. How we can generalize this project to our own, local context, and we can see it happening if we have our passion and interest and motivation. So thank you again, and I would like to officially close the webinar. Thank you, Tony. Any comments from you, or just should I end? Bye-bye.
Thank you.
Okay.
Thank you, Tony.
And
Thank you for
thank